Sorry for the technical delay. I think it's my computer, but we're talking today on integrative primary care, and EJ is here with us. And as I said before, EJ is our new PA. You can see EJ here.
Hello.
So we can share your screen. Do that basically, like that. Okay, so we're going to talk first about CIH updates, and we'll do that a bit, and then we'll talk with EJ about integrative primary care. So new cases are starting to go back up a little bit, and I know the governor just made an announcement that, you know, masks are required again for being indoors and things in public places, so I also agree with that. There are different components to immunity, and we know that it's not just about the B cells that are generating antibodies with vaccines, but it's also about the T cells and natural killer cells. So we do want to think about, you know, how to improve immunity. Of course, we've been talking about that for a number of weeks here on this weekly wellness webinar. But interesting.
Dr. Wong, your screen's not shared. I don't know if you knew that, but.
Got it. Okay. Let me just. Can I close all this stuff because for HIPAA reasons. You can share the screen here. Okay. Sorry about that. Share screen. There we go. That, you can see that now? All right. So a Singapore study did show that half of people that were not exposed to coronavirus actually had T-cell responses to the SARS-CoV-2 coronavirus. So prior exposure to past common cold coronaviruses may actually be protective, which is giving us some hope against the current coronavirus. That was an interesting study if you want to look at that. We are focusing our efforts on optimizing immunity here at CIH, and so at this time we're not really recommending that people that are asymptomatic that haven't had exposure to actually get tested for the coronavirus nasal swab, because there are problems with sensitivity and specificity for it. I know we've done some tests, but sometimes it's hard to know what to do with it, especially if you're not symptomatic. So if you are symptomatic or have asymptomatic exposure, then we would rather you go, directing you to go to clinics like CVS Minute Clinic or other clinics that are in the area for nasal swab testing. So we can talk about that later if you would like. And then we are going to be offering a flu vaccine here, which is egg-free, preservative-free, and mercury-free. That is available in late August, and we have an integrated vaccine protocol that I've been reviewing in the last couple weeks here. But optimizing sleep is really important for vaccine response, actually. A good night's sleep is going to improve the antibody response, optimizing the gut microbiome, and also supporting immune system activity with things like mushrooms, mushroom tea, nutrients, including IV nutrients. You can do an IV therapy immunoboost within 3 days before or after a flu vaccine to help. And that's only one of multiple ways to activate the immune system. We know that vitamin C, D, zinc, and many other things can really help with response to viruses to strengthen and balance the immune system. We also know that reducing screen time less than 2 hours a day is really helpful for your overall health, optimizing vitamin D and blood sugar, and optimizing gut health, and some herbal considerations here, including licorice, astragalus, andrographis, and oregano, turmeric, and mushrooms. And please discuss all this with your practitioner. This is not considered an official recommendation. Basis here. Here's our August schedule coming up. So we have Shannon Lavery coming to talk about yoga with us here, and we have Trish Devney, a friend of mine that is going to be discussing sound healing from Arizona. That would be really great too. Both of those were great. And then Colleen Zuntek will be back in late August talking on herbal medicine again, which was great last time with Colleen as well. On Thursday, August 13th, I will be away at the beach, so we will take a break at that point, and hopefully everyone else will take a break as well. So that's great. What topics are you interested in the future for the fall for these wellness webinars? We want to be of service to you. We are or thankful for the opportunity to be of service to you here. So, and we again thank you for your time today. And a lot of people showing up today, so thank you so much. So traditional Chinese medicine, I'm just going to read out the choices. You can read them there, but TCM, acupuncture, nutrition, gut health, LDN, which is a compounded medicine that is used for pain, autoimmunity, and mood, and many other things that we do prescribe here as integrative practice. Compounding pharmacy, you have a friend that would be interested in that too. Sleep, lifestyle medicine, thyroid, or other, anything you want to say, please write in the chat box too. Postmenopausal HRT, thank you for that. Let's see. Angela, thank you for that. Okay. So hormones, so definitely 2 votes for hormones already from the chat. So that'll be great. We can definitely talk about that. So really across the board, a lot of people in hormones, 2 people wrote in hormones. So really anything could be really, that's great. It just shows how diverse and variety of interests here in our practice. So thank you so much for all that. Let me see if there's anyone else. So 3 people from hormones. Okay, thank you very much. Louisa, thank you very much. And let's see. General joint pains that do not seem related to an injury. Okay, yeah, that could go along with the LDN and overall chronic inflammation. Thank you so much. Holly, thank you so much. Okay, so going to the next. What future group visits? So some of you have done these virtual group visits on insurance, trying to offer some health, more prevention, and more being proactive about your health, because we know that health doesn't happen in a vacuum. It really happens with knowledge and intention, and knowing some things about how to prevent disease, how to augment your health is going to be really helpful moving forward here. So here are some of the topics in functional medicine from a systems biology approach. Cardiometabolic is going to be things like vascular disease, heart disease, hypertension, high cholesterol, diabetes. That's called cardiometabolic. Energy, you might see things like migraines, headaches, chronic pain, how to improve your mitochondria to improve energy. That would be energy. Immune we've done before, but we have like pretty much always regenerative interest in immune, optimizing immunity. And then gut health, Katie and I have been doing some gut health group visits as well, and then hormones is there, and write in the chat if it's not on here too. So postmenopausal and hormones, as Louisa said, thank you so much. Vitamins, supplements, Chinese herbs, definitely we blend some of that in. That's a good one. Biological dentistry, that could be a good one for a more of a wellness webinar. I think that's a great idea. If you could write that down, Jen, that's a good one there. So hormones, again, the winner seems to be the big winner today. Yeah. Energy is the big winner. Everyone needs more energy right now. Immune, gut, and cardiometabolic. Okay, great. Thank you so much. Headaches. Okay, yep, that would be under energy too. Thank you, Irene. So start with EJ, just to talk with EJ a bit and meet EJ for a second. So it's EJ.
Hello.
I'm going to be kind of off the side.
Okay, sounds good.
Right
no,
and I can,
sounds
I
good.
Can try to sign in again, but
okay.
So how did you get into integrative primary care, functional medicine, holistic health? How did you get into that, EJ?
Okay.
Kind of
just in case you guys can't hear the question, he's asking how I got interested in primary care and integrative medicine as well. And it really started like when I was pretty young. I have my family to thank for that. And specifically my mom. I mean, growing up, she faced some different health issues, and instead of kind of letting those conditions take over her, she really strived to
I'm going to try this and see what happens.
Okay. Just gonna take this off here. But she really strived to make lifestyle changes with nutrition, different herbs, supplements that ultimately changed her life for the better. And kind of since that time, that's something that I've always held in the back of my mind. I was thinking about this talk because Dr. Wong was saying, how did you get interested in integrative medicine? I think when we were growing up as kids, we would have ice cream cones in our house, but they were toasted nori with toasted pumpkin seeds. So we just kind of early on like developed these different things. And I went to school. I went to James Madison University for undergrad and then also for PA school. And during my time there, I worked as an EMT, I worked in the hospital, and I always thought I wanted to do acute care medicine. I just had loved it. But what I realized when I got there is that so many of the things I was doing were taking care of the sequelae of chronic diseases that people were dealing with. And I think it was just the root cause, like knowing what my mom had been through and the experience I had had. This was the only way I could picture practicing medicine for the rest of my life. So it's been great.
I have a similar story too. My mom also has some issues that she was able to really reverse, with nutrition and getting out more and getting some her vitamin D up and things like that, and cooking organic foods. And I think that definitely influenced me in my career path as well. So thank you for sharing that, EJ. Yeah. So how have you? I think I guess we could ask other what are your kind of interests? I know you're starting out here. You have a lot of really interest in holistic health, and
Yeah,
you've learned so much already. So it could be a multiple choice answer too. But what have you really found that you kind of gravitate toward you at this point?
Yeah, I mean, a couple of things I think I've gravitated towards. I think one that I've realized in myself and like dealing with my own kind of ailments, and then also working with patients so far, is that like lifestyle is so important. And no matter like what I'm dealing with, if I go back to the lifestyle, like I always see like little improvements, which is great. I think hormones are really interesting. I'm really interested in like our environment and how it affects us, between like the water, the air, EMFs, all those different kinds of things, and how they affect our body, and just like how we can use those things to function optimally.
Yeah, that's great. And we're all living on the same planet, right? Our planet's polluted, and we're getting further and further from nature. So in a way, integrative health and functional medicine, some of the ultimate root causes are about, how do we get back to be more in alignment with nature? Because our bodies are always trying to heal themselves, and the more we're incongruent, right?
Yeah, especially now with COVID too. I know a lot of people like just getting outside, like the reminder to get outside. We're all working at home, like so many people working at home in front of the computers. So I know that's a big thing I've been talking about with patients.
Great. Awesome. Thank you for sharing that. Let me see if I can. I think you have the share screen now, I believe. Unless you want me to do it. Yeah.
Nope, I got it.
Okay, great.
Yeah.
So now we're in the different room, so we can take off our masks and have a little bit more oxygen here, which is nice.
So I'm just going to start by introducing integrative primary care. Basically, what we're doing here is a little bit different from what you might get at your typical primary care office. I think one of the big things that we are focusing on in our primary care is really getting to know our patients, listening to their stories, and really finding out what will motivate them to get better. That's the absolute crucial part of curing whatever they're coming in to see us for. And really, like, I know Dr. Wong says this all the time, but that you yourself as the patient are the CEO of your own health. And as practitioners, we're here to kind of help guide you and support you in the best way possible.
And that's revolutionary, right? Because I mean, from a traditional medical and should I say almost patriarchal, system, it's sort of like someone's telling you what to do, someone's telling you what medication or supplements or lifestyle to do. Ultimately, you're in charge anyway, right? I mean, that's where we're more of a partner with you, and it is about, we're going to work with you, provide expertise, but it's really going to be about your health, your wellness, what your goals are, what your your body the best, right? Your mind and spirit the best, and we're here to help support you, but not tell you what to do, right? And it's very different. Yeah.
Exactly.
And like EJ said, lifestyle is crucial for prevention and reversal of disease, and so that's a big pillar of what we do here too.
Yeah, definitely.
Great.
Yeah, so this basically just talking about here, we're doing primary care, so your typical annual physicals, all that kind of stuff, but also approaching whatever you're coming to us with, your goals, with a root cause approach to figure out, instead of just saying, oh, well, we'll talk about some different case studies today, but instead of just saying, you have high cholesterol, let's use a statin, maybe we'll backtrack and see, well, what possibly is causing these elevations in cholesterol? Dr.
We're going to
Ryan?
go through that today. We're actually going to go through
Yes.
cholesterol today as well, so I'm excited about that.
Yes. I don't know if you have any more to say about the services offered or.
Yeah, I mean, I think we're going to get into that during some of the cases that we're going to present here. I would just say that, you know, looking at it from a more holistic perspective, right? We're having more, you know, we're lucky, I would say. We're very lucky to have more, I would say, more holistic tools in the toolkit, you know, so to speak. I mean, there's a lot of ways to treat someone, a lot of ways to move the needle on health and wellness. So I think, you know, drugs and surgery are some of the answer, but it's not all the answer, right? That's where you get the lifestyle, the meditation, the nutrition, you know, acupuncture, massage, myofascial psychology. You know, so many things can be really helpful to move the needle, and it depends on the person's, you know, goals and preferences, like you said, and also our clinical experience. I think, you know, treating a lot of patients, like seeing a lot of, you know, patients and cases, and, you know, we can really offer what's going to be the best and individualized, you know, treatment for each person, and in treating you like a person, not a number, which I think is a big thing here for integrated primary care. And then collaboration, right? I mean, basically not being siloed, you know.
Yeah,
So
exactly. Yeah.
we're going to go through some case studies here. So really primary care plus, we're going to go through some studies. I think this one is
Yeah, I can talk about this one.
Great.
So arthritis, so we are just going to kind of compare, and we would love for you guys to also chime in and tell us any solutions that you've found, treatments that you've done that you've found really helpful for these different case studies that we're going
Yeah,
through.
so just go ahead and chat, you know, come in and chat and stuff. Okay, before we start, I know it looks like Irene had her hand up, so let's just see.
Oh, okay.
Irene, do you want to chime in here? I just want to make sure you have some time. Jen, can you help her with that? I'm not sure.
Yeah, so the talking's permitted, so if she wants to, she can unmute, and if it's a mistake, just let us know.
Okay. Okay, so Irene, if you want to talk, you can just unmute. Otherwise, you know, if you can figure out, she has to do it herself from her end, right?
Yes.
Okay.
Okay.
Okay, well, let us know if you want to talk about
Yes.
something, or if you want to chat, it's fine either way.
Yep. I'll keep going here and then.
Yep.
So arthritis, some of the conventional approaches might be NSAIDs, anti-inflammatory medication, PT, surgery. So one of the things that we're thinking about, I think, when it comes to arthritis is inflammation and what is causing this inflammation. So I think gut is always one of the big things. I think this first case study here, foods that are going to be irritating to the gut can cause the leaky gut. I think that we've talked about before, but things like gluten, sugar, and then with that can come this kind of inflammation of the body with joint pain all over. So simple things like eliminating sugar, eliminating gluten can make a huge impact on joint pain and arthritis symptoms in particular. There's also a lot of other modalities that we can do, functional movement, that's including PT. I know Dr. Hiza does amazing work here with patients with joint pain,
Yeah.
acupuncture, other supplements like curcumin that are anti-inflammatory, and what else was I thinking? Like any type of body work, I think, as well. But really getting to the root cause of what is causing that inflammation, I think, is really important. And then also the Arthroben. I don't know if you want to talk a little bit more about that, Dr.
Yeah,
Wong.
Arthroben is a fruit and vegetable powder, basically, and it's very highly anti-inflammatory. It works on 3 different enzyme systems. So the typical NSAIDs are going to be dealing with what's called the cyclooxygenase system, which is going to reduce inflammation in that pathway. The problem is when you block COX, which is COX, then it upregulates LOX, which is lipoxygenase, which essentially means that your body's trying to tell you something with inflammation by, you know, sending a message to your brain to say that, oh, you know, I'm in pain or something, right? So then it's going to upregulate LOX. So you really want to try to block, you know, you want to try to reduce COX-1, COX-2, and LOX, which is what Arthroben does. You know, if someone is having, you know, maybe they just need to eat more fruits and vegetables. I mean, that's what happened with the 80-year-old man that we saw that had basically joint pain all over, and he eliminated all sugar. So you know that when you eliminate foods or, you know, fake foods like sugary processed foods, which are not really foods, then your body, you're kind of forced to already to eat real food, you know. So I think I don't know how much of it is like eating too much sugar, which I think a lot of it is, but how much of it is not eating enough real food.
Yeah.
That would also provide a powerful anti-inflammatory effect. So one way to kind of get started on that anti-inflammatory train is to take something like Arthritis. I think, let me look here. It should be gluten-free, Laura. I believe so, yes. We can double check on that. Jennifer was mentioning, that was a great share too. Thanks, Jennifer, that she was prescribed low-dose naltrexone. That's another thing that can be used to decrease arthritis as well.
Yeah.
Wheatgrass, I don't think wheatgrass, I'll have to double check. Do you know, Jen, is wheatgrass gluten-free? I think it's a different, I mean, it shouldn't be, shouldn't have gluten in it. We'll look that up and we'll let you know. Thank you. Thanks, Jen. Okay. So I think we can go to the next one. Okay, so one of my favorite topics is brain health, so I'll talk about this. So brain fog. How many people have not had brain fog? Actually, how many people have had brain fog? Thanks, Araceli. Yeah, ever. Just basically feeling a little slow, a little bit sluggish in the brain. Maybe the thoughts are coming, but not as quickly, right? That's sort of, so it's not necessarily cognitive impairment. I mean, that's sort of like a pre-dementia or mild pre-dementia type of state, but brain fog could be someone that, you know, things aren't just clicking as easily, right? So it's about optimizing your brain health. So a conventional approach for ruling out dementia anyway would be checking a mini mental screening exam, doing a CT or MRI of the brain, ruling out thyroid, B12, and syphilis. That's sort of a conventional approach that we learn in school. The integrative approach we do, and some of you have already done this, is the evoke quantitative EEG, autonomic nervous system testing with a vital scan, end-up lab work, which we kind of do to look at other vitamins besides B12, and to look at deeper metabolic type testing as well. And we think about nutrition, we think about lifestyle, including exercise, curcumin, which will decrease NF-kappa beta, which is an inflammatory marker molecule, basically, that would be involving brain inflammation, as well as omega-3 fatty acids and phosphatidylcholine. So some of this we can do through intravenous as well, with the PC especially, and that can be very helpful in cases where there's trouble with liver detox. So I think we would say that, you know, there is a couple case studies we can say already from people that we've really seen over the last year, you know, so we did more of the brain work, brain reboot kind of work, is that we have one 70-year-old man, let's say, with mild cognitive impairment, losing his memory, you know, can't find his keys and, you know, stuff like that. So, you know, we found in the brain scan that it's likely he has sleep apnea. We confirmed that with a home sleep study. And then he did get a new mattress because the mattress is really not comfortable for him. So that he was, you know, he got a new mattress, treated the sleep apnea, he had more energy, better memory because he's getting more oxygen to the brain, basically. So that's really huge, you know, to treat that. And then a 75-year-old woman with mild cognitive impairment, also with some support from her daughters. And, you know, I think that, you know, sometimes these things can wax and wane, but certainly with lion's mane, which is a type of mushroom that kind of looks like the mane of a lion, which is why it's called that. Phosphatidylcholine, which helps to convert to acetylcholine, which helps with memory, and glutathione, which helps reduce oxidative stress and inflammation in the brain. She became more talkative, you know, better memory, etc. So, you know, these things have to be ongoing, and these have to be, you know, in coordination with lifestyle and nutrition as well. And then a 50-year-old woman with brain fog, again, you know, who of us doesn't have brain fog at times, right? I can't read that part. I don't know why my screen is. Can you read that for me, EJ?
As optimizing hormones, exercise, sleep, brain fog disappears.
Yeah, so again, it's looking at, you know, maybe someone that's, I know a lot of people want to talk about postmenopausal hormone replacement therapy. There are risks and benefits to that, but certainly one of the issues is that by upregulating the estrogen, binding the estrogen receptors in the brain, then a lot of people have their brain fog disappears from that. So that, and then getting a bit more sleep, managing stress, and then healthy nutrition. So definitely we see a lot of those as well in terms of results there.
Yeah, and I'll say that the sleep apnea, it's so interesting because a lot of patients, one, they don't know they snore, or even if you don't snore, you could still have sleep apnea. So I think with like brain fog and fatigue, those kinds of things, it's a really good test just to check.
We always want to check EEG.
Yes.
We always want to check a home sleep study. We have these home sleep studies from WatchPat One now, where we can just ship a disposable, essentially, home sleep study to you and bill that through insurance and get that read by a certified sleep doctor. So that's really huge. Yeah, you don't have to be super symptomatic, except you may just have fatigue. You might have brain fog.
Yeah.
You know, it's not just about snoring anymore. So that's what we're finding, is that it's very much more prevalent than expected, and there's lifestyle ways to treat it at times. Sometimes you have to use CPAP or dental device as well. Okay, so yeah, brain health. I mean, we do a lot here. If you have your people that that just want to optimize your brain, I just feel like we all need to optimize our brains in some ways to function better. So that's kind of a big thing there. Depression, I think that's me again. So depression, so what I want you to take away from the brain fog, depression, and cognitive impairment slides here is that these are labels, right? They're not actually what's going on. What's really going on is brain inflammation. So I could almost say from a root cause perspective that brain fog and cognitive impairment and even Parkinson's and Alzheimer's and depression, although they have slightly different pathophysiologies, the root cause is brain inflammation. So we have to think about, why does therapy work? Therapy works because it reduces brain inflammation. SSRIs or other antidepressants can be really life-saving for people, and we do prescribe those here as well. And sometimes they can lift someone out of an acute valley of depression, right? Someone needs that for a time to kind of bridge the gap between that and lifestyle and doing some trauma therapy or other therapy like CBT. Sometimes you do need that for a conventional approach. That doesn't necessarily address the root cause of what's kind of going on, which is brain inflammation. The brain inflammation is going to reduce serotonin and dopamine expression in the brain, which then makes someone feel like their mood is not very good. So reducing inflammation through healthy proteins and fats, especially through nutrition, 60% of your brain is made of fat. So you need healthy fats. Fat is not the bad guy the way that thought it would be back in the 70s and 80s. It's actually very helpful for you if you eat good fats. Reducing inflammation through, we definitely had some people on, please comment or chat about this, if you have some thoughts, is that nature, nature, you get people out of depression really quickly because, again, connecting back to the earth, getting fresh air, sunlight's going to activate your pineal gland in your brain to make serotonin. Acupuncture also does the same thing, increases serotonin, dopamine, and then anti-inflammatory supplements. Dr. D actually has had some patients that, and this is a really good thing here is, putting people on fish oil, which we're talking about, but also omega-3 fatty acids, but also turmeric and curcumin. Sometimes people's brain depression goes away, right? So this quote unquote depression, after taking some anti-inflammatory herbs or supplements like turmeric or curcumin, all of a sudden there's no depression anymore. So I think that's really interesting. How much? It depends on the person. Probably talk to your practitioner about that. We usually start at about 500 twice a day. And then, so our case studies here, and then we'll get to some questions. A 67-year-old woman with depression. So one of the big questions we ask in our practice, which you probably know already, is what brings you purpose and joy? What brings you purpose and joy in life? Because your thoughts actually also create reality biochemically of serotonin and dopamine. Thoughts and emotions do influence the physical reality in your body. So this person liked gardening, so one of the prescriptions was, well, go out in the garden and garden more. Have beautiful azaleas or beautiful peonies, or I'm not a gardening expert, but certainly trying to get in that here. But gardening, you're already getting out in the sun, getting that serotonin, that endorphin rush, but from being outside doing something you love. So do more gardening, do more something you love to get you out of this quote unquote depression. And then we also decrease inflammation, brain inflammation through omega-3 fatty acids. You usually need about at least 3 grams of omega-3s to help depression. And depression lifted, from that. Pretty simple stuff. 35-year-old woman with depression, the brain mapping EEG showed that there were some imbalances in the brainwave quantities, and so nerve feedback was done, and her mood lifted after about 10 sessions of that. And we were able to reduce the dose of her medication also. Let's see. Yes, hormones can be an underlying cause of depression. Absolutely. What pharmaceuticals can cause depression? Well, if you think about it, most pharmaceuticals actually damage the mitochondria and can affect the adrenals. And adrenal glands, cortisol, DHEA, by depressing that, sometimes the energy, the fatigue from that can cause depression. So we can also think that that's
just like overall inflammation from
inflammation. Yeah. So yeah. I mean, that's almost like another. I think we should talk about that with our pharmacy friend. I think that's a great question.
Yeah, that would be great.
Yeah, with Jay. Are there brands you recommend? There's a lot of brands. I guess we could. Let's see. We like CuraPro here. CuraPro is from Euromedica. CuraPro has 40+ clinical trials in Europe. which is where they do a lot of supplement research, and their governments actually sponsor these, where they have, basically non-subjective, they have, I guess, non-subjective and objective research on clinical outcomes. So I think we use that for that reason, because it's research-based. All right, so we'll go to some other chats. Let me see. How do I see what, I think some people have questions. I want to make sure we get to that too.
Yeah.
And we can go to that. So Joanne, let's see, let's start with Joanne. Joanne, you're up, I think, if you can unmute yourself.
Oh, sorry. I was raising my hand to say that I have brain fog.
Don't we all? Don't you? Well, you're welcome to the club right now. At times, right?
I'll put my hand back.
Thank you. Thank you. Well, thank you for sharing. Well, we all have brain fog at times, even if it's, it's not as much sleep one night, or, if it's more than that. Yeah, I mean, so it'd be interesting to hear other people chime in if they've kind of had brain fog kind of figured out. Definitely for me, sleep is a big thing. I think sleeping more, your brain just functions better. I think avoiding inflammatory foods, those type of things. Christine, thanks for joining, Christine. I think you're on the chat too. Or possibly. Let's see, how about Monica, do you want to say something on the chat? I think you're on there too. Okay, you guys can feel free to chime in there. Why don't we move to the next slide? And then we can.
I believe this is it. Okay, so fatigue, this kind of goes along, I feel like, with what we've been talking about before. Fatigue is a pretty general topic, and there's a lot of things that can cause fatigue. I think we always kind of go back to lifestyle first and think about that, and then go from there. Improving mitochondria function with foods. Red light therapy, I know we've been doing in our office, is great. Your green leafy vegetables, juices, the chlorophyll aspect. So that's part of the mitochondria, correct, Dr. Wong? That's in the green vegetables.
Yeah, I can explain the biochemistry to that.
They can stimulate that basically as well.
Yeah, one of the things before we get to case studies that chlorophyll found in green leafy vegetables, or you can juice them, plus the light from near infrared light, which you can get through red light therapy, you can get through full spectrum light if you're outside, that light plus chlorophyll will activate cytochrome C oxidase, which will help the mitochondria and the electron transport chain produce energy. So light plus greens taken together is going to give you more energy, right? Basically, so eating more plant-based foods, if you can tolerate that, plus getting out in light, getting some red light therapy would help. Araceli runs that here and is done a great job with that. So thank you for that. I see you here on your Araceli. Thank you. Yeah, so we've been doing that protocol with some folks, and they've had some good results. You can overdo it if you're not used to that much light. I found that you have to go and do small doses, because we're not used to being outside all the time, or like having really bright lights. So I think you just want to make sure, but it really can help the energy.
Yeah. And I think, another thing too, just looking at like micronutrients, hormones, a big one, thyroid, making sure, we'll talk about thyroid a little more, but making sure that you have a full thyroid panel completed is really big. And then, diet and optimizing your micronutrients. And I think too about like protein intake. And I know we always talk about like stomach acid, like, are you actually absorbing the protein that you're eating? Because if you're not, then those kinds of things can cause fatigue as well. And then I know, like, I love coffee, I'm a big coffee drinker, but that can also kind of deplete our adrenals as well and exacerbate fatigue. Our case studies down here, so we have a 60-year-old man with chronic fatigue. So using adrenals and gut support, optimizing B12 levels, able to hike, a lot of miles on vacation and feeling really good. So just kind of supporting these systems that we already have can be really helpful.
Yeah, so just he went from like not being able to get off the couch basically, which I mean I guess we're all more we might be all more sedentary now, I don't know, but so it's starting slowly, because it certainly didn't start with going from couch to 11 miles hike, but of hiking, but that was pretty dramatic there.
Yeah. And then a 25-year-old woman with chronic fatigue and insomnia. Oh, wow. That sounds like me at one point in life. Um,
From your EMT days or
yeah, it's for my night shift days.
night
Yeah.
shifts? Yeah, yeah, yeah.
But yeah, I mean, I know so many people my age, especially like in healthcare, working like crazy schedules, and that really takes a toll on the body. Sleep is so important. Like our schedules are crazy, so just like managing those small lifestyle things, making sure that you're getting really good sleep every night, making time for yourself, like scheduling time in your day for breathing and just to kind of unwind is so important, because if we don't, then we kind of empty the tank without ever really filling it back up, and we're just depleting the energy, and that's why we're feeling this fatigue.
Yeah, yeah, that's true. And sleep starts in the daytime. You know, the way what you do during the day to relax and to kind of replete that energy tank, like EJ was saying, is going to help you with circadian rhythm at night and going to sleep, so you can
Yeah,
get rejuvenated for the next day.
exactly. I know some of the sleep hygiene things we talk about is like, dimming the lights a few hours before bed. If you can wear like blue light blocking glasses can be really helpful. And just kind of having a sleep routine to help you get into that restful state can be really helpful as well.
Yeah, there is a blue blocking glasses called blueblocks.com. A little
Yeah.
expensive on the $50 to $100 side, but that is research based in terms of being proven to block some of that blue light that otherwise would from your cell phone, computer, or night lights that would otherwise prevent you from falling asleep.
Yeah, and I'm big too on getting the devices out of your bedroom. If you can turn off your Wi-Fi routers at night, like take the computers, put your phone on airplane mode, all those things are disturbing to our sleep. So I think that's another just big thing to keep in mind, especially as we're moving towards like work and home in the same space. Just
We are literally electromagnetic creatures, right? The electromagnetics are, coming from our body. Like the electromagnetics, we're basically that's running all our organs and tissues. So devices can actually disrupt that. So I definitely think that putting your cell phone and your device as far away as possible from your bed is probably a good thing,
yeah,
for you.
yeah,
Getting outside, again, just kind of getting your feet. I mean, this is something that I think we could talk about here in this slide is earthing.
yes, yeah, definitely, I agree.
Yeah. And so earthing meaning getting out, getting in the soil barefoot, and connecting with the earth.
Forest bathing, connecting with our
Forest bathing, yeah. There's a shinrin-yoku, which is a fancy Japanese term that means basically getting out in the forest and hiking and being out in nature.
Yeah.
Earthing mats, yeah, earthing.com, there's earthing mats. Jen was saying definitely sleep better with the phone on airplane mode. Okay, that's great. Great insights. Okay, but we can go here to the,
Here.
how are we on time, Jen? Are we good or? Doing fine, okay. Headache, I think I'm doing headache, right?
That sounds good.
Headache, so another basically mitochondrial issue, a headache. Anything like pain or headache, there's a mitochondrial issues which need more energy in the brain. This is a headache is a symptom that your body as your friend, your body's your best, when you're best friends, or your body's your best friend. So in terms of always watching out for you, and you want to listen to your body, listen to the symptoms. So headache or other types of pain are a signal from your friendly body to say, hey, the mitochondria is down here in the brain. So, help us do something about it so we can get rid of the headache. So the conventional approach to headache is to take Advil, aspirin, or, to Advil or other NSAIDs, triptans, maybe if there's migraine. And there's some other things like Botox for migraines and stuff. So that's sort of conventional approaches to reduce some of the symptoms, band-aid to some of the symptoms. Sometimes we need that. However, there's also integrative approach additions, including things like reducing inflammation. Again, inflammation is going to cause mitochondrial depletion and headache. Reducing brain inflammation through balancing blood sugar, through eliminating food triggers, through myofascial release if it's a structural issue, through acupuncture, and through IV nutrients. And we've had really good success with IV nutrients specifically. Laura and Megan and I have been talking about IV nutrients, and having higher dose magnesium B6 and IV has really helped a lot of people with migraines. Yeah, nutritional yeast I think can help. I know it's good with B12 for sure. Jen, if you have any other B12, you can let us know there. So we have case studies. Yeah, thanks. So some of the B vitamin forms are not ideal for nutritional yeast. Supplementation might be better with that. There might be other sources of B12 that would be better too from a food perspective. So 60-year-old woman with frequent migraines getting acupuncture, myofascial release, and IV migraine protocol. after 3 or 4 sessions help tremendously. Sometimes it only takes 1 session, but you know, again, trying to reboot that mitochondria so the pain signals go down, so then someone doesn't have migraines anymore. 44-year-old woman with frequent migraines. Again, foods can be a trigger. We do have food sensitivity tests here. You can also just do elimination diet working with our nutrition team, which is really great and really effective. And sometimes that can be a cost saving if you don't want to pay like $300 for a food sensitivity test. Eliminating gluten and dairy being 2 of the biggest immunoreactive foods, you know, for people. It causes leaky gut and cause brain inflammation, cause migraines. So, you know, the 44-year-old woman, after eliminating gluten and dairy, the migraines really reduced in severity, and she didn't have to take the triptan as much. So that was pretty much what that was about. Yeah, dehydration can definitely cause headaches. That's a great, thank you, Peggy.
And another thing I was thinking about as you were talking, Dr. Wong, was breathing too.
Yes.
As someone who has headaches and I know the pain is horrible, I think that breathing in the moment is just one of the best things that we can use. I know I've done Wim Hof breathing when I've been having.
That's great. Oh, Corey is doing a free 7 a.m. class. I was on there today. Okay. Great remember that when you're breathing more deeply, you're getting the oxygen in your body, and the oxygen's giving you more energy, which is going to help headaches.
Yeah. It all comes back to the energy, really. But
yes, exactly. So dehydration, definitely, Peggy, because you're not really when you're thirsty, it's already too late. You're already like super dehydrated at that point, because we don't really have, humans, you know, we don't really have a great thirst mechanism. So a lot of times we're actually already dehydrated. We're not really getting that thirst mechanism, but I think once you feel thirsty, so definitely trying to drink water, you know, between meals, would be good. You know, you can drink lemon water, you can drink herbal teas if you want. Things without caffeine, you know, would be kind of good for, you know, preventing dehydration. I think Holly was asking about eliminating dairy. Does that include also eliminating plain healthy yogurt? Well, yogurt being a milk product, you know, any milk product is going to have it's called A2 beta casein, which is casein being a milk protein that can be very inflammatory for some people. So yeah, that would still be considered dairy. Yeah, thanks, Jen. So all forms of animal dairy, basically. I guess in theory, ghee might not be as bad for some people because they tend to filter out the casein, which is a clarified butter. Okay, so we can go to, okay, so EJ, I think that's you here. Go back to I think it was.
Oh, thank you. So yeah, high cholesterol, this is definitely a big topic. So conventionally, I think we talk about low-fat diets, some like nutrition, different things, exercise, and I know most people have heard of statins, kind of the main, I think they're in the top 3 prescribed medications in the US.
A big money maker, yeah.
Yes, yeah, they are. So some of the things that when I'm approaching a patient with high cholesterol, there's a lot of different things that can influence these elevations, inflammation, hormones, detox, especially liver and gut detox. Your genetics can play a big part in it as well. Hormones, one thing I always think about is thyroid too. I think that's one of our case studies down here, so we can talk about that a little bit more. But one of the case studies here, a 56-year-old man with high cholesterol. One of the profiles that we run, it's called an advanced lipid profile. So basically you have your standard lipid profile that'll look at your total cholesterol, your LDL, your HDL, triglycerides, those numbers there. This more advanced panel will allow us to kind of look at how many LDL particles do you have and what is the size of those particles? Are they small and damaging to the blood vessels? Are they big, fluffy, and will just bounce off the vessels, not really causing as many problems? And we also look at things like CRP, which can tell us about inflammation in the body, fibrinogen, which can tell us about risk of clotting, and those kinds of things. So with this patient showing a lot of LDL particles, we made some diet changes. Carbs and sugar are a really big driver of cholesterol, not so much fat as what was like previously thought. Getting up, moving, purposeful movement throughout the day, adding a supplement called red yeast rice. Red yeast rice is similar to statins, but it's not as potent. And we often recommend that you take CoQ10 with the red yeast rice. And then curcumin, just general anti-inflammatory. And nattokinase is a blood thinner. I don't know if you have a little bit more about the mechanism.
It can help to break up biofilms. It can help with blood clotting, decreased risk of blood clotting, basically.
Yeah, so kind of with this regimen here, improved lipid profile and was able to bring down that fibrinogen level to decrease risk of blood clots. So two really important things there. And then another interesting one, a 45-year-old woman with high cholesterol, IBS, and fatigue. So we know gut and thyroid can have a really big impact on our cholesterol. Thyroid, we can look at different kind of patterns. If the HDL is getting kind of high, we might start to think, oh, maybe this is stemming from the thyroid, kind of like the slow metabolism picture, not being able to break down the cholesterol, and gut with general detox as well. So there's a lot of different things from a root cause perspective that we can look at with high cholesterol.
Yeah, I think we have a few comments about that. So I just wanted to, so Angela's asking about, should we limit our vitamin K foods if we're trying to thin the blood? So typically, you're saying, I think you're saying if you're on a blood thinner, should you be limiting vitamin K foods? That was more of the case with Coumadin, and some people were on blood thinners for atrial fibrillation and things like that. Typically, you wouldn't overdose on vitamin K foods. You know, you could, I guess, I think because vitamin K is involved with the clotting factors basically, and actually would coagulate the blood more. So I think you don't have to limit the vitamin K foods, because a lot of vitamin K foods are found in really healthy foods like certain greens. So I wouldn't limit the vitamin K foods for that reason.
Yeah, I agree.
Yeah. Okay, and then we do have we have one other comment that I'm seeing if we can share that, but we'll go on to the next slide, I think, if we can here. Pantothenic acid B5, which is B5, can it help cholesterol? It can help with oxidation of fats. I haven't really seen it alone in isolation help with cholesterol so much. It can be really helpful for adrenal support and for energy production. No, it's so Kathleen, you're okay with us talking about your experience with cholesterol? Yes, okay. So Kathleen was saying that she just reduced her cholesterol by 100 points. That's amazing. With red yeast rice and with phorestrol, which is a beta-sitosterol, which helps to bind some of that cholesterol. So that's a great result with that. And that can be done without the same side effect of statins. Some people do need to be on statins, and it's important to know that if you're on a statin, you should be taking coenzyme Q10 to help with the mitochondrial energy, because they can get depleted by a statin. So that is important to know. Yeah, intermittent fasting. Okay, great. So I think we're on to blood pressure. I think also EJ.
Yes, I'm just going to plug in my computer really quick if you want to start.
Sure, I can start. Yeah, so high blood pressure or hypertension. So we know that there's a conventional approach, a dietary approach to stop hypertension called the DASH diet, low salt diet, exercise, blood pressure medications. These are kind of the conventional approaches. We know that not everyone is sensitive to salt. Some people are sensitive to salt. I think the salt in an integrative functional world is somewhat controversial. I don't think everyone needs to be on low salt diet, depending on what type of salt you're taking. Some, at least 10% of the population is salt sensitive, so then it would actually help with blood pressure, but not everyone is. So, real salt, Himalayan pink salt, those type of things are going to be a better salt with some trace minerals in it to help with your vascular health, actually. And then from an integrative approach, you have to think about balancing the autonomic nervous system. And you also have to think about, so things like heart math, we have heart math here now, biofeedback, to help to balance the nervous system, to improve that vagus nerve, which is going to help downregulate the sympathetic nervous system, which is the fight or flight nervous system. That will kick off adrenaline that will raise your blood pressure. So yoga is really great and meditation is really great. These things, these treatments, I call them treatments, but they're really lifestyle practices, can really lower the blood pressure by as much as 10 points, just with some of these really powerful lifestyle practices, breathing, 4-7-8 type of breathing. And then, so we want to balance the autonomics. We want to also increase the nitric oxide with foods like beets, like arugula, like other greens that are high in dietary nitrates. We also want to do some exercise to help increase that blood flow and nitric oxide. Red light therapy and sauna are really great therapies to also increase nitric oxide. There's some supplements that also can increase nitric oxide too. And then we want to improve insulin sensitivity and metabolic syndrome by reducing sugar and refined carbohydrates. The interesting thing is that there's receptors in the blood vessel that are for blood sugar and blood pressure, and they crosstalk with each other, and blood cholesterol as well. So they crosstalk. So if you treat one with lifestyle or with some of these treatments, then it's going to often improve some of the other things too. Case study, so 38-year-old female with hypertension and family stress. Well, so that also may be either more or less right now with COVID, but family stress. So went to do counseling, heart math, acupuncture, did some supplements like L-theanine, which is an amino acid in green tea, and ashwagandha that reduced your blood pressure and anxiety. And then we have a 55-year-old male with hypertension, overweight. So really did more of the nutritional route to increase fiber, magnesium, which helps to open the blood vessels. Aged garlic extract is a research supplement also to help reduce blood pressure, and some beetroot powder, and the blood pressure decreased by 10 points, which allowed him to avoid medication.
Yeah, I have several patients right now who I'm working with who didn't want to go on blood pressure medication and are doing the lifestyle things, and adding in nitric oxide has actually helped to bring down the blood pressure to the point where we won't have to add medication, which is just great.
And then tying back to the brain, because I love to tie it back to the brain too, is that if you increase blood flow to your heart and to your vessels, you're not only going to reduce high blood pressure, but you're going to reduce your chance of dementia too, right? Because blood vessels flow everywhere. So really we talk about high blood pressure as a cardiology issue, but the vessels go everywhere in your body. So treatment of hypertension and basically optimizing vascular health is really a total body treatment. Okay, time is 12:57. Okay, so we'll go on to the next. How many more? So we had pain. We should definitely do this one. Thyroid, weight loss. Okay. So we can do this. So pain. Do you wanna do this one, and then we can?
Yeah, sure. I can talk about this a little bit.
Okay.
So with pain, some conventional approaches are, again, the anti-inflammatory, like NSAIDs, Advil, that kind of stuff. PT, possibly surgery. I think in like integrative medicine, functional medicine, we just have a lot more tools in the toolbox to kind of explore different options that are going to work well for people. So whether that's body work, whether it's going to be like mind-body practices that are going to help you decrease the levels of pain that you're feeling while we're getting to the root cause of what is causing your pain. I think it's kind of a twofold, finding it from the root cause and also treating the symptoms, because pain itself can cause stress, anxiety, like feeling that way. But I know one thing that we use a lot for pain is low-dose naltrexone to help reduce inflammation, which we've seen to be really helpful. And then just in general, reducing inflammation through the body, again, having a good nutrition plan, eliminating foods that are gonna irritate the gut and cause issues there. And then, yeah, I think another interesting thing, this other case study, the 33-year-old female with joint pain, muscle pain, fatigue, it was found out to have Lyme. So I think looking into those types of infections and different things that can cause this pain to happen is really important.
And we do have a Lyme specialist here too, Marna. Some of you may know Marna, who's our nurse practitioner here. Is really expert at treating Lyme and very passionate about that. So definitely see pain, also caused from a lot of different. And another thing that Dr. Giza has taught me too is that sometimes when you just don't move your body much, right, basically just gonna get stagnant, the muscles get stagnant, the blood vessels get stagnant, the lymph flow gets stagnant, and then you have pain because you're not able to detox, you're not moving in the body. So really always want to stretch. I might do that right now. Let's go on to the next slide. Just to stretch, everyone stretch a little bit. After about 30 minutes, really should, based on NASA research, kind of get up, move your body a little bit, get up out of your chair. Thank you, Meredith, for coming. I know it's about 1 o'clock. We're going to continue a little bit longer and try to get through the slides so that we have a little bit more. Thank you so much. I mean, someone asked about the, I would just say a little bit about this very generally, but the blood pressure guidelines were reduced from 140/90 to now 130/80 in terms of what's considered hypertension. So I would say that there's evidence that I've seen that there's probably some, pharmaceutical influence in terms of those guidelines being more strict on the blood pressure, which is basically going to mean more prescription of drugs. So just someone had a question about that, so we'll leave it at that. And then I think thyroid is huge too. I think you maybe talk about that, EJ.
Yeah, I think one of the biggest things that I would just say about thyroid is that conventionally we don't check a lot of markers for thyroid, and it's interesting. We check the hormone that comes from the brain to stimulate the thyroid, and then the inactive form of thyroid. So integratively, we want to check all the markers of thyroid, what's going to stimulate your thyroid to release inactive form of thyroid hormone, and then also looking at the active form, the reverse T3, which kind of puts the brakes on the system, and then if there are any antibodies present is really important too. And then looking at all these different areas, adrenals, micronutrients, gut, infections, toxins, because all these things can halt the thyroid from working properly. The gut is really important for converting T4 into T3. Infections and toxins can inflame the thyroid. And then we need micronutrients to, one, build our thyroid hormones, but to also have that conversion happen. So I think these cases down here kind of explore taking out gluten, removing sugar was simple things that they did and had infertility and were able to go on to have a beautiful baby girl. So that's awesome. And then just repleting those micronutrients that we had talked about before, the zinc, selenium, omega-3s, vitamin Ds, all that kind of stuff.
Yeah, so basically we'll have a virtual group visit on thyroid. I know there's
I think
a high interest in that.
Yeah, just on thyroid.
Just on thyroid. Basically, you want to try to convert from your school bus, which is a T4, to the T3, which is like a Porsche or other fancy car, in order to basically increase your metabolism. If you think of a car as your kind of metabolic, engine, basically to give you energy, you really want both T4 and T3, but you want that conversion to happen. So there's all these things that we need to kind of look at in terms of root cause. So that's really good. So we're going to go to, and we do a lot of thyroid kind of treatments here too. Weight loss. So obviously people are, I don't know how many are going to the beach this summer. I know there's a lot of interest in weight loss, or basically healthy weight. Sorry, there's a phone in the office here. I'm going to ignore that phone. So the conventional approach is CICO, which has been disproven. Like research has actually shown that this is not a valid option. In terms of it doesn't really work. In terms of population studies, is calories in, calories out. Now, it will work in the short term if you fast for a certain amount of time with low calorie or less calories. So I'm not saying it doesn't work in the short term, but it doesn't really work in the long term in population studies. So this whole eat less, exercise more is pretty outdated now. So we need to kind of zoom into 2020 with this. So food quality does matter. What you eat is an energetic information to your genes, and it's going to actually reduce inflammation and help weight if you eat more organic plants and pasture-raised animals and really real food. So the balance does matter with macronutrients, and that you would want to eat typically more of a balance of carbs, protein, fats, and whether it's paleo or moderate carb or different things. Work with the nutrition team here. They're very expert in that, and I would say that there's an individualized approach for everyone. It's not like one size fits all. Hormones matter, especially insulin, cortisol, thyroid, sex hormones. They can drive weight gain. They can drive the inability to burn fat. So I think that's really important to look at hormones. So it's not just about calories in, calories out. It's about the gut, it's about hormones, it's about stress levels. It's about what you're eating and what you're putting in your body, and then what you're not putting in your body, which is you don't want to put in toxins, you don't want to put in pesticides or GMOs. So all those things are really important because you want to go back to nature with your food. So we have a 65-year-old female with high blood sugar, wants to lose weight. So cooking more at home, you have to learn how to cook to lose weight, or have to have like a delivery service. If you're busy, you can there's some food services that we can recommend. A lower carb plan, cooking more at home, 25-pound weight loss in 3 to 4 months. She's a very active person, likes to swim, likes to do all these things, and so that's great. And then a 55-year-old male with weight gain and fatigue. So again, that sleep apnea is kind of rearing the head again. Sleep apnea is going to cause weight gain. It's going to increase cortisol. That's going to prevent you from burning fat off. So they did sleep apnea treatment, intermittent fasting, a whole foods kind of nutritional plan, and they also lost weight and improved their energy and probably prevent dementia as well. So I think we're almost.
There was one question here, I believe from Jacqueline, asking, would you treat someone with Hashimoto's but blood levels are normal? Which I think one part of that is like, what are your symptoms? Because we always want to treat the person, not the labs itself. But yeah, if the antibodies are elevated.
Yeah, there's two types of treatments for thyroid. One is, are the hormone levels low, then you might want to replace the hormones. But if the hormones are normal and the antibody levels are high, then that means there's ongoing inflammation, ongoing destruction of your thyroid gland. So you do have to treat that, which is a little bit more proactive than sort of a typical, office where they're just checking your TSH and T4. They're not even checking for antibody tests. So you don't even know if you're having sort of this brush fire, right? There's fires in California, Nevada, but if you don't treat the brush fire, it's going to go out of control eventually. So we do take a more proactive approach there, and we try to bring those antibody numbers down.
Yeah.
So
And
you don't have to treat that with thyroid hormone all the time. It can be other ways.
Yeah, and I think also exploring like what is causing the elevation in those antibodies is really important too.
Yes, yeah, the root cause. And then Cindy was asking about thyroid. Would you treat someone with low T4 and higher T3? I don't see that. We don't see that too much, but yeah, you could just do straight T4, and you could just see. You do have to follow the labs a little bit with that.
Yeah.
So we can maybe get more into that. And then we have one more slide, which I think is a really important slide here, is on basically what is integrated primary care in terms of what, from a practical sense, how do we truly prevent disease? How do we focus on truly optimizing wellness and truly moving towards healing for the whole person? We really want to look at lifestyle. We can't outrun lifestyle. We can't out-supplement lifestyle, anything like that. This is what's called the SMART lifestyle factors here, which are SMART, which is sleep, mindset, activity, real food, and ties. So we look at some of these, assessments here, deep assessments of labs, vital scan, evoke EEG, even stomach acid testing, to really understand what's going on with the physiology, so that you can use that information to optimize your lifestyle factors, to change the direction of your health. So looking at that, and then sometimes looking at, a lot of times integrated referrals to really powerful ancient healing traditions like acupuncture, like massage, like holistic PT, like health coaching, biofeedback with heart math, nutrition, food as medicine, neurofeedback, Reiki, and red light therapy. All these can be really helpful, modalities for you to help you heal. And I don't know if you want to talk about this a little bit, EJ. We can kind of maybe tag team on this one.
Yeah, definitely. Yeah, I think the integrative referrals are great. And then with the different modalities talking about here, I mean, breast, prostate, bone, and colon are kind of like, I think, 4 areas that I tend to focus on in physicals, and just seeing, are we having regular screening for those things, but also how can we prevent things from happening in the future? I mean, diet is one of the big things, reducing excess insulin and cortisol. I think for all of these is so important. With breast health, definitely looking at, how are our estrogen detox pathways? Do we have excess estrogen? What is our family history of breast cancer, or other estrogen, other symptoms of estrogen dominance?
And I think another really broad point is that prevention and screening are different, right? We do screen here for, we do mammograms, DEXA scans, colonoscopy referrals. We do referrals for those. That's screening. That's not prevention. So you want to do both.
Yep.
Prevention is looking at, hey, excess insulin and cortisol, we have to change your lifestyle. Is a reduced toxic load from too many pesticide-laden foods, right? Those type of things. How do we improve your estrogen detox pathways to prevent both breast and prostate cancer? Interestingly, for prostate health, regular sex actually has been shown to prevent prostate cancer as well, or I should say it's associated with reduced risk of prostate cancer, because you're detoxing that prostate through the prostatic fluid that you would get from regular sex too. So for all the guys out there, or for your partners that are male, please let them know about that. Bone health, colon health, same thing. So how do we actually reverse osteoporosis? How do we actually prevent osteoporosis? There's ways to do that through gut hormone and structural activities. Heza has really been amazing here. Learned so much from him about how to reverse osteoporosis. I didn't even know that we could reverse osteoporosis until I met him. Like he would see patients and basically help to reverse osteoporosis. So. And then colon health, the studies actually show that a more vegetarian or pescatarian is better. Chicken's kind of neutral, and then red meat, you want to do more moderation. Fried food, red meat, you want to do more moderation, and high fiber diet is generally good. So having regular bowel movements. I think that we probably are over time for sure, but a little bit more, but thank you for staying this long.
Yeah, thank you all so much.
Yeah, I think we really, I just want to thank EJ for coming on, and you've done a great job here, EJ, and I know you continue to do a great job really kind of up-leveling our practice in terms of integrated primary care. And, it's really about care, right? When we think about health care, right? It's not a health business. I mean, we have to, we're a company, but it's health care. So how do we actually care for the patient, right? So what Dr. Francis Peabody said back in the, I think, 1800s is that time, sympathy, and understanding must be lavishly dispensed, but the reward is to be found in the personal bond, which form the greatest satisfaction of the practice of medicine. One of the essential qualities of the clinician in integrative primary care is interest in humanity. We care about people, because the secret of care for the patient is in caring for the patient, and that's what we try to do in integrative primary care.
Oh, yeah,
Yeah.
that's awesome.
So anyway, that being said, a quote from Dr. Peabody there.
Nice.
Thank you for everyone for attending.
That's great.
EJ, any other final thoughts here for today? We'll definitely do more integrative primary care webinars, so that was really fun.
Yeah, no, I love working with the patients here and just with people in general. So
Yeah.
I'm here to help.
Yeah, so if you have met EJ already, then I think you know how great of a clinician and great of a person she is, and how caring she is for her patients. And if you haven't already, I'm sure you will at some point. So definitely, we're going to sign off here. I think someone asked about miraculous magnesium. I'm not sure about that. We'll get back to you, Charlotte. Maybe if Jen, you could look at that. But thank you so much, and thank you, Babby, thank you, Angela, thank you, Holly, and Jennifer for those comments. Thank you all for attending today. We will see you back next week with yoga. Thank you so much.